Schwartz and Commander Miller of the federal government. We're entering into a plan to increase our testing by 1,000 tests a day. These are going to be, sorry guys, hang on one second. Now, come here. Oh, no. Sorry guys, I have an unpotty trained puppy that came into my study, and that's not going to end well, so I just tossed the puppy out. So we've entered into that deal. We'll ink it tomorrow because we had some minor areas to work out, but that will allow us a lot more testing. We'll be able to do mobile clinics like we did in Irving the last couple of days, do a lot more of those with a lot more frequency, and also get into a lot more nursing homes, halfway houses, jail, etc., places where the meat packing plant, wherever there's a hot spot. So that's good news on that. Yesterday, we saw the most deaths that we've seen ever in Dallas County, the most cases that we've seen ever. What you need to focus on is that, I'm not saying you shouldn't look at that, we report it, but what you should focus on is ICU admissions for COVID, hospitalizations for COVID, and ER visits for COVID, as well as deaths. So that death number is not looking good, obviously, for this coming week, but those other numbers thus far have stayed flat. Now they're what we call trailing indicators. If I get sick today, I may not go to the hospital today, and if I do go to the hospital today, I may not go to the ICU until later, and I may not die until I've been on the ventilator and in the ICU for quite some time. So they're trailing indicators, but so far they are flat. These are the indicators that the CDC, the local health doctors who did the color-coded chart that we talked about, and basically every doctor group in America say are the ones for people to look at on judging what their activities should be. And so again, those are right now relatively flat. Like, one of them went up by a few people yesterday, but not significantly. So that's something we have to watch. The thing to realize, and there's not a whole lot we can do about this as business people, but the analogy that was used with me that I hope will be helpful to you in understanding the challenge that we have right now is it's like if you've ever seen lily pads in a pond, and there were a few lily pads, and then the next time you went by the pond, it was just chock full of lily pads. What happens with that is you look and the pond has 8 or 9 lily pads, and if the lily pads are replicating, once a day, then the next day you hardly even notice that it has 16 or 20. But 5 or 6 days later, when the whole pond is covered with thousands of lily pads, then you notice it and you've got a huge problem. But you actually have a huge problem if you're trying to keep up the pond or keep public health well before that happens, right? But we can't see what's happening under the water. Lack of testing, lack of history with the disease and know what to look for means that the water's murky. We can't see what's happening down there. And so unfortunately, by the time we do see a trend, that trend may be, really hard to control. We're learning more and more. Dr. Robert Haley's the head of epidemiology at UT Southwestern. He addressed the commissioner's court yesterday about mask wearing. And he believes that if everyone wears a mask when they're out, that we could virtually kill the virus based on what they're seeing. So we've gone from March, when they said, don't wear a mask, masks are in short supply, bandanas do no good, masks are silly, to mask might be a good idea, go ahead and wear one, to now saying the most important thing we can do is wear this mask. So, and that's the nature of a novel virus, where we're learning more and more. The doctors, that is, are learning more and more as they study it. So that's really an important component. Things you might do in your business that the county is experimenting with as they open is, depending on your type of business, offering people a relatively cost-effective and disposable covering when they come in. some businesses are saying, hey, if you want to come in here, you need to wear a cloth face covering, and telling people ahead of time. And I think that's one approach, and it's a reasonable approach, and it works well for some businesses as opposed to others. So for instance, if I am a counselor or a wealth manager or somebody who's going to have people come in for a 3:00 appointment, telling them ahead of time to please bring a cloth face covering may work well. It may be more difficult if I have a big sign, I'm trying to lure people into buying my product to make that happen. But that is a great way to keep our employees safe. We're even discussing today the possibility of, can we provide some masks to all of these protesters who most of them actually are wearing masks, but they're all within like 2 feet of each other. And they're all chanting and singing and speaking in loud voices. So a lot of droplets going all over the place out there. And so what can we do about that? Because that, we know that large gatherings are the big, public health wise, as far as spreading the virus. There's no better way to spread the virus than a large gathering. And so that's a huge concern. When we switch over to policing and what's happening, the number one question that I get from people about COVID is, when are we going to get back to normal, right? Well, when it comes to this policing, I think probably everyone on this call could agree, we don't want to get back to a normal where every 10-year-old child who's Black is having a talk with his parents about how to keep safe in a police interaction. Whereas, white families don't have those talks, with their children, as a matter of course. Now, if your kid's a real hellraiser like I was when I was, probably somebody need to have that talk with me, but I'm talking about just as a general, every child, you just don't see that outside communities of color. And we need to radically transform the way that we hear each other, the way that we police, the way that we engender grace and respect to one another, so that every person, no one wants to be stopped by the police. Everyone's heart skips a beat when the lights go off on behind their car and they're pulled over. But we need to get it to where everyone feels that and not only feels, but they are being treated equally. There's all kinds of ways we can do that. I got a list last night from, Chief Hall, the chief police in Dallas, T.C. Broadnax, and John Crusoe joined a conference call I put together with faith leaders and civil rights groups who were here in Dallas, who were most critical of us. And we listened to them for 2 hours. They asked me if I would post their demands if they sent them to me. And they sent their demands. We posted those last night. Some of those things we all know would be good things, right? We know that police officers are not mental health professionals, but they're put into a place where they have to go out and respond to mental health crisis situations. And that can lead to some, very bad outcomes, both for the officers and, of course, for the person that they're called out. We've had mentally disturbed people who, until the officers got there, were not committing crimes, were maybe making threats, walking around aimlessly, who lost their lives because they became scared and enraged and threatened the officers. And most notably, a man with a screwdriver a couple of years ago who was shot 9 times. And so looking at ways to get mental health crisis teams, non-uniform crisis teams, either with an officer if there's a threat of violence, or as a first responder before the officers have to get there if there's not, is something that they're requesting, or I'll use their word, demanding, and something that makes all the sense in the world to us as well. It's just a budgetary, issue. And there are going to be clearly things that people want to have happen that don't happen, but we do have to move as a community towards something happening. So I think a question that a Black friend of mine asked me and I'll just ask everybody else on this call, the person made the point of they're tired of white people asking them, what are you doing? Or how are you doing, rather? How are you doing with all this? I'm sorry this has happened. This is such a shame. This is so unfair. How are you doing? That's a nice show of concern for a friend. But a better question, not a question, a better thing for you to start your conversation is tell that person what you're doing. This is bad for our country. Here's what I'm doing. It could be a little thing. I'm sending $25 to the XYZ, fund. I'm having a talk with my children about, race in America, whatever it is. Well, I'm going to do everything I can. So is Chief Hall, so is TC, so are others. I think I've got some Congress people and police chiefs meeting tomorrow. We're doing what we can, but everybody's got it. This is everybody's deal, right? It's a policing deal first and foremost, but we've all got to do what we can to move our country into a more perfect union on that. So with that, I'll take y'all's questions.
Great, and everyone, if you have questions, please put it in the chat bar. Moving back to COVID, recently in the news, Dr. Fauci has said that we might have a vaccine by the end of the year. What's your take on that, and Dr. Huang?
I never second guessed Dr. Fauci, who I got to know during Ebola and who's tremendous. I hope that's right. There's no guarantees on any of it, but that would certainly be an answer of prayer. So.
Great. And also you mentioned the mobile units. How are you deploying those? Based on 100% on data or requests from cities or?
We'll be using PCCI, Parkland Center for Clinical Innovation data, as well as the Community Health Needs Assessment. There could be, their collaboration is good, right? So if we hear from a city or even a private business, hey, I want to provide a test site, here's why I think this is good, then we would plug that, into that. There's 100 FT, full-time employee equivalents. This is a chamber group, I didn't have to tell you that. There's 100 people that will be doing this every day. 2 vans full of people, and then as you mentioned, we'll have some sites. The challenge of sites, the one that we just did in Irving for the last 2 days, and part of that is because of the way the state did the sign up for it, but where you can only sign up to go get a test like 48 hours or 24 hours, something like that, before the thing got there. We only got, I think it was 82 or 72 people tested over 2 days in Irving. We're talking 1,000 of these things a day, right? And you either use them or lose them, right? And the feds are saying, this is it. This is our big monthly push. Then we're done. Of course, they say that we're 6 for 6 on getting a little bit more. So we'll see how that goes. But, so we definitely want to utilize these. And probably the best way we're going to do that is go into places where there's large chunks of people. Might end up even being some businesses, but starting off with jails and nursing homes and homeless shelters and halfway houses and mental health hospitals, places where people are in close proximity and we can test 200 or 300 people in a morning.
So we need to get a little more volume there through there if you need testing. So we'll make sure we get that out to all our members when the mobile sites are in use and where they are.
We're also looking now that we've had a big setback in that again, but we're also looking at doing what's called a serology study that a lot of businesses have been pushing us to do. UT Southwestern will take a lead on that. That's where we test 25,000 people in a variety of ways, try to get an idea of prevalence in the community. It's useful for all sorts of things, opening businesses, all kinds of things. But that we had a setback. I'm not even sure what the setback is because I'd expected to try to negotiate with the feds this morning to approve using some of the tests for the serology study. But then I was told at like 1 o'clock this morning that the team that was working around the clock on that could not pull it together with those particular tests. So maybe in a few weeks with different tests, we'll be able to pull that together.
Great. We have several questions on openings of businesses. Can you give us any specifically nursing homes, memory care facilities, and corporate events similar to wedding venues. Do you have any insight from the governor's office of what his plans are?
No, weddings, I believe. Oh, do I have any staff on this call? Because I think weddings are open, aren't they?
Yeah, the question was not weddings, but corporate events similar to weddings.
Oh, I got you. Okay. No, I don't have any. My inclination would be that is coming soon. My inclination, rather, but I don't know what exactly what his plan is, on that. What he's done and what Dallas County has done as well on nursing homes, and it's very tough because families want to visit, is they've had, consistent with the CDC guidelines, some restrictions on who can go. Now, we are making some exceptions to that, even within this. Some very rare, my order is a little less restrictive than the governor's. End of life is permitted in my order. And then we've had people that they just don't eat if their daughter doesn't feed them. And so if you're in a situation like that, contact Health and Human Services, and we'll figure out something on that, because we're not going to have your mom starve to death. Okay, what else?
From Mara Gas from our ICVB, we believe the next round of orders from the governor may have other types of meetings in the mix with a capacity threshold, according to conversation with Texas Hotel and Lodging Association. So that might be coming shortly for everybody on the call. Switching to, go ahead.
No, I was agreeing.
Great. So switching to food and housing, can you give us an update on what businesses can do to help with food or any housing issues that we're seeing out there with the unemployment rate?
Sure. So we're pretty good in shape on food. We talked to North Texas Food Bank last night. The FEMA Region 6 person for the 5-state area and I lobbied last or 2 months ago, I guess it was, to change the federal rule, which ultimately happened that it did change. And so that the Feeding America groups like the North Texas Food Bank could be direct beneficiaries of federal aid. So they are getting ample enough food, and they're in pretty good shape right now on food. Housing is a different story. So unless there's another extension, evictions can be filed and heard again on cases where the current rule on evictions in Dallas is if you were current on March 27th and you have since fallen behind on your rent, and I believe this only covers residential, not business. This was a negotiated deal between me and the DAs, and if it were up to me, it'd be business too, but I think it's just residential. So if the residential person is up to date, March 27th, it's fallen behind now, they can't be evicted yet. But unless there's another extension agreement starting on June 15th, which is, less than 2 weeks, they will be able to file those evictions and begin those. Now, as a practical matter, those folks, it's not like everybody's going to have to leave their house on June the 15th. But there are all kinds of things you can do to help with that. We are trying to put together a group through Catholic Charities and Jewish Family Services to go to the JP courts and have interactions with people who are about to be kicked out of their home, particularly moms with little kids, and see if we can get some money to them through the CARES Act, so that it won't necessarily be paying all the back rent, but maybe if they say, look, Mr. Landlord, what if we paid you, X% of what she owes, and you give her another month, and we put her on a payment plan, and she promises to pay you even after she moves out, and I don't know what else. But trying to keep that couch surfing from happening and that homelessness from happening. The highest unemployment rate that we're going to see for this according to Rob Kaplan, who runs the president of the Federal Reserve Bank here, is this quarter, so ending June 30th. So we got to do everything we can to keep people, help people through now. I'm pushing on the county to push out more and more money for these things faster and faster, because people need more help now than they're going to need after they've been to work for 3 months.
All right. And then on mental health, we have a question from Sam Reed. You mentioned the huge concern relative to mental health. What specific information can you share if we have friends with a need?
If you go to dallascountycovid.org, the all one word, and county is spelled out, dallascountycovid.org, there are mental health services right there on that homepage. They're free. Now, not everything your friend's going to need is going to be free, but at least a phone consult, is available there, as well as links to the major mental health care providers beyond that. And so, that is a very stressful thing. I will tell you all, as business people, I probably need to do more of this, but I may have mentioned this on one of these calls before. After the police shootings and the decision to use a robot to kill the sniper, David Brown and I, at David's insistence, I think T.D. Jakes had called us like at 1 o'clock in the morning while this decision was being made. And they said, what can we do to help? And so then that happened, and everybody's kind of, so then after that, we're thinking, what could he do to help? And he goes, what we really need, what David said is, what we really need is we need to go see a counselor. And I said, yeah, I'm not really into that. And he said, no, we need to go, just talk to this counselor. And so we did. We went and talked to the counselor separately. Probably only lasted 5 or 10 minutes, but I wasn't eating in the days that followed that much. And I got my appetite back. And so I think when you're going through this tremendous stress, it is a good idea for healthy people, to have someone to talk to. And if you don't have somebody to talk to, you can't talk to somebody in your family or brother or your sister or what have you. And maybe they're not the best person to talk to about this, is people should reach out and do that. It's not a sign of weakness to talk to somebody. Since even in this twice, very briefly, I have talked to the same police shooting counselor that I talked to on that, just about, what I was seeing, what was happening, whatnot. So I think that's a very useful, thing to do. And then to lift each other up. People call me throughout the day. They're so gracious to me, lifting me up. I've probably had 36 ministers just call to pray with me. And so you can do that for each other, right? Call each other, check on each other, not so much talk about the next problem, but just find out how each other are doing. I think that's a really big thing, because this is a really long deployment for all of us. It's really a deployment for you too in your business. So we got to all take care of each other and take care of ourselves.
Thank you for that. That's next to curfews. Can you tell us what the county role versus the city's roles are? I know our Chief Spivey here in Irving is coordinated with Chief Hall on curfew times.
So kind of a confusing thing, but the short answer is within the curfew zone, the curfew zone being, which you can get on a website, it's all within the city of Dallas. It goes over to Trinity Groves, it moves around, or it goes, I can't remember exactly where it goes, but it's a big box around downtown. Everything in that is now 7. The confusion the 2 nights ago was they had left out the Frank Crowley Courts building. And so the protesters had gotten there and were legally protesting after 7 because it wasn't in the city's curfew. And so I made that one later to accommodate those people that were there when I made the thing I think I made it 10 o'clock or whenever it was the lawyers got it to me. I made it a minute later. And then and it's called ex post facto law. You can't make something illegal that was legal I can't say it's illegal for you to drive 55 on the highway until tomorrow, right? I can't go back, right? Okay, so that was the first day. Then we're going to do 8:30 for that building and all county buildings. After then, because the city didn't want it in their curfew plan, but then the city thought more about it and said, let's expand the curfew plan. So now all those buildings are 7 to 6. Now, other county buildings are still 8:30. 8:30 gives you time to, it gets dark about 8:31, 8:32, it's moving further into the night. Let me strike that. It gets dark about 9:10. The sun goes down at 8:31 or 8:32 this time of year. So that gives people a safe place where we have officers already, and we can keep them safe and keep looters from infiltrating, and then they can get back in their cars and go home by dark. So that's where we are. But downtown, it's 7 now. Right.
Yes. And what would you give advice to businesses if they are in areas where not the protesters who are doing the right thing, but the looters are coming through? What would your recommendation be for businesses?
Have us on speed dial, and it depends on exactly what the threat is in your area. But if you can get tamper-resistant surveillance up there, so that you can get a picture of the people. If somebody's going to come in and break your window, spray paint, loot your store, if you can get their picture, that is incredibly helpful. I do not recommend that you stay on premises to protect your property at night, particularly in a curfew zone. We have a tremendous police force out there. I mean, they're tremendous men and women. What I mean is there's a heck of a lot of people out there right now, right? We've got people from several groups out there. And so it would probably not helpful, frankly, if you're there. You saw the man who tried to protect his store over by the House of Blues and was badly beaten. Very sad situation there. So I would recommend that you have good surveillance. You board up windows if you're worried about them being broken. We've had a lot of our windows broken the first 2 nights in downtown in our county buildings. So what we're going to try to do is give a release for peaceful protest and demonstration, and then do that in a way that we can watch it and keep it from being infiltrated by people who want to smash windows and steal things, or worse. And so, but that'd be my advice to you. Don't hang out there, and don't, stay to protect your property. If you do live downtown or in a curfew area, or you live outside of that and someone is banging around and demanding things or whatnot, call 911. Don't try to take care of it yourself. And then beyond that, that's a longer discussion about castle doctrine and all kinds of things that I probably shouldn't go into with you, but different rules that come into play there.
Judge, what are you hearing about how long the curfews will last, and what's your decision making on these things?
So I think they'll last I think what the city told me was, the city of Dallas, that is, ours only affects county buildings. Okay. So in Irving, there's not a curfew yet in Irving, correct?
There is in certain areas also. Okay. So our downtown area, our Las Colinas area, and Irving Mall area.
The only area, so if the Irving curfew's before 8:30 and our building's in the Irving curfew area, the Irving curfew area is deferred to. If we have a building anywhere in Dallas County that's currently not in the curfew area, it's 8:30. But my curfew only runs to county buildings. It's not a county-wide curfew. If Rowlett has no curfew and people are out driving around at 9:30 at night, the fact that the county, tax office, may be not accessible to a protester after 8:30 doesn't mean you can't go to Sonic Drive-In at 9:30 at night. So, but my guess, at least with the city of Dallas, is that theirs will last another 5 days or so. But it's just unknown. We're in an unprecedented time, and those can be extended as long as they need to be. But obviously, you know, we prefer to have those there just as little as possible.
Great. Well, thank you, Judge. We try to keep it to 30 minutes because your time is valuable, and we do appreciate your leadership. If you could leave us with a few thoughts, and we'll adjourn.
Yeah, you know, just a few thoughts would be, you know, talking about curfews. You know, I know that's hurtful for some of your business if you have some nighttime economy businesses. And so really, if we could just all think about that question I asked you earlier of not how are you doing to our you know, neighbors of color, but what am I doing? And, you know, start that conversation by when you talk to them about what you're doing, which then forces you to actually, you know, not just, you know, think, but to act. So you'll, you know, have that thing to tell them, right? And we just all got to work our way through that. In the face of all this, we've got to keep making smart decisions on COVID. As more and more things open up, as we go from 25% in the restaurant to 50 to 75, there'll be more and more opportunities for people to come in contact with each other and get sick. If what we've seen over the last 7 or 8 days, where we've gone from 170 cases a day to yesterday, 257, the most we've ever had. If that continues to trend upward, it just means there's more likelihood of you bumping into an asymptomatic COVID or them coming into your business and infecting your staff. And so it's imperative that we do those 4 things that we talked about, you know, pretty much on every call: avoiding those crowds, 6-foot distancing, face covering wearing, and hand hygiene. And, you know, you know, I mentioned self-care. Practice good, you know, self-care. Take some time away from this. You know, talk to folks. Realize that whatever your role in this is, it's an unprecedented time. It's stressful. So give each other grace, but make sure to give yourself grace as well.
Amen. And thank you again, Judge. You're doing a great job for us here in Dallas County. We really appreciate it. And everybody, thank you for being on the call. If you have additional questions, please reach out to us or directly to the judge and his staff. And they've been gracious to answer all the questions we've ever had. So really appreciate it, Judge.
Thank you.
Thank you all.